Hello to everybody, I'm Clemente Lauretti and in this video I want to briefly introduce my work. It deals with the surgeon robot shared control for ergonomic pedicle screw fixation. Pedicle screw fixation has become the standard procedure in clinical practice to stabilize the lumbar spine in patients with spinal deformity. This procedure consists of 4 phases: the cortication of the pedicle dorsal cortex, making the pedicle screw packed, screw placement, screw connection to the rod. In clinical practice, the screw path is achieved either by drilling or tapping the pedicle. Pedicle tapping, differently from the drilling, consists of threading the patient's pedicle for a more accurate screw insertion. However, control strategies able to automate this procedure are still an open issue, and pedicle tapping is still manually performed by the surgeon, who is exposed to uncomfortable postures and muscular fatigue. On the other hand, drilling procedure is fully automated, and this results in less muscular fatigue for the surgeon. Nevertheless, during automatic drilling, the surgeon has no control on the forces exerted on the patient's spine. Therefore, the objective of this work is to propose a novel approach to robot-aided pedicle screw fixation that makes the tapping procedure semi-autonomous. The proposed approach will guarantee a surgeon full control over the forces exerted onto the patient's spine, sufficient accuracy in making the screw path, and then comfortable postures and less tiring operations for the surgeon. The proposed surgeon robot shared control can be derived from a conventional inverse dynamic control. It is described in the equation that you can see in the slide. Here, Y is the modified control law. This control law consists of 2 terms, a position and a force control action. Gains of both control actions are referred to a frame whose z-axis match with the tapping axis. Conversion between this frame and the robot-based reference frame is achieved through the adjoint matrix that you can see in the slide. The proposed approach was tested on the KUKA lightweight robot. A comparative analysis among the proposed approach and the ones typically adopted in literature to perform pedicle screw placement was carried out. 8 healthy subjects were involved in the experimentation. They were asked to tap the pedicle screw path in a dummy spine in 3 different modalities, as you can see in the slide: traditional manual tapping, traditional robot-aided tapping, and by means of the proposed approach. Performance indicators were then computed from sensors data to retrieve quantitative differences among the 3 modalities. Subjects' posture and muscular fatigue were assessed during the experiments, as well as system performance in terms of accuracy and efficiency in screw placement, and in terms of subjects' evaluation through questionnaire. Well, now let's take a look to the experimental results. I want you to notice in the left figure the results achieved for the force control. As you can see, the blue line, namely the torque exerted by the robot about the tapping axis, is directly proportional to the force supplied by the surgeon along the Z direction, that is the yellow line. Moreover, as we can see from the bar chart on the right, the EMG root mean square, the comparison among the average activation levels of the considered muscles highlights that the adoption of the proposed control strategies guarantee a reduction of muscular fatigue for the surgeon. Moreover, the results obtained from the RULA test show that there is no risk to incur in musculoskeletal disease when the proposed approach is adopted, differently from the other methods that require significant ergonomic improvements. To draw the conclusion, this work has proposed a novel approach to robot-aided pedicle screw fixation that is based on a surgeon-robot shared control. It guarantees full control over the surgical intervention, high accuracy and comfort for the surgeon. Thanks for your attention.